Absolutely. Good morning. My name is Dr. Jennifer Savage. I'm the Clinical Education Coordinator for the Masters in Athletic Training program here at JSU. Today we have Courtney Hood that will be discussing if concussed collegiate athletes are more susceptible to depression. Thanks for joining.
Okay. All right, my name's Courtney. Very sorry about my voice, but just hang in there with me for the next 10 minutes. Like Dr. Savage said, we're going to be talking about if concussed collegiate athletes are more susceptible to depression. So to give a good introduction, there's an interdependent relationship between concussions and depressions over the years. It has been an increasingly popular topic. The competition level for college athletes has also increased as well. With that also means that there is kind of a demand on the body and the mind of the student athletes. They gotta have to juggle their athletics, their sports performance, their scholarships, self-esteem, and then if they get injured, and then obviously their recovery process as well. Depression has become one of the most considered psychological disturbances after a concussion because of the prevalence rates go up from a mild case of 6%, and a more severe case they go up to about 77%. I'm going to talk about concussions first. So a concussion is defined to be a trauma-induced altercation in the brain, in the mental status that may or may not cause the individual to lose consciousness. A concussion can occur from a direct or indirect force to the brain that is applied to the skull that causes the brain to rapidly accelerate or decelerate. There's an estimated 1.6 to 3.8 million concussions that are sports related every year in the United States. That was in 2012, so that number has significantly gone up as well. When an athlete sustains a concussion, the signs and symptoms can affect their cognition, their balance, their coordination, vestibular and oculomotor function as well. Once an athlete is suspected of a concussion, they kind of go through a series of standardized tests that kind of evaluate multiple domains of the brain's function, neurocognitive and more motor control as well. One of the tests that are most frequently used is called the SCAT-5. It kind of combines all of those tests into one simple test for athletes to use or athletic trainers to use. It assesses memory, balance, their Glasgow-Coma scale for like the impaired consciousness of an individual, a symptom checklist as well. Once an athlete is officially diagnosed with concussion, they kind of fill out that symptom checklist every day until there's no symptoms. After that, athletes go into what's called a return to play protocol, where you go through light activity to kind of get the heart rate up. Then you go into non-contact, and then you go into practicing a little bit, and then you get released by a physician. And then I'm going to talk about depression. So the American Psychiatric Association for Depression describes depression as being a serious mental illness that can affect how an individual feels, how they think, and how they act in a negative manner. Depression has many symptoms such as insomnia, irritability, loss of energy, thoughts of suicide, lots of negative thoughts, and then it can also change their appetite, which may make an individual gain or lose weight. An article written in 2003 stated that the prevalence of risk of depression in collegiate student athletes goes from 15% to 33% within the first year of the student athlete being in college. Usually it's seen more, or females report more of their symptoms than males. Not really any scientific reason behind it, it's just females are a little bit more honest about their symptoms than males are. The United States Department of Health and Human Services reports that the age range for depression goes from 18 to 25, which is kind of that college range. So depression can be, a person can get depression from either their biochemistry, so their abnormalities in the two brain cells, or chemicals, serotonin and norepinephrine may contribute to depression symptoms, and then it can also be in the genetics. It can run in the family. So if you have an identical twin, if one of them has depression, there's a 70% chance that the other twin may have depression at some time in their life. Also, their personality. If someone has a very low self-esteem, they can be overwhelmed with stress, and then they're vulnerable to depression as well. And then you have your environmental factors. If an individual grew up with violence or neglect or abuse or poverty, they might be susceptible to depression as well. And then also any type of mental conditions like a brain tumor or any type of vitamin deficiency can cause that as well. Once an athlete starts showing these signs, I think it's really important that athletic trainers notice these signs and you're able to refer the athlete to a psychiatrist so they can get the help that they need, whether that's antidepressants, that's therapy, or a combination of both. So there was a study done in 2023. It was a 30-day study with 615 NCAA Division I and Division II collegiate student athletes. They kind of focused on depression, anxiety, and self-esteem. It was concluded that 22% were at risk for depression, and then 8% were at risk for the anxiety and the low self-esteem. So my focus clinical question, I'm asking, are concussed collegiate athletes more susceptible to depression? My patient population is collegiate athletes. My intervention would be concussions. I don't really have a comparison group. And then my outcome would be depression. Sorry. So my search strategies I used the JSU library. I used Google Scholar, PubMed, and Sports Discus. The keywords I used were concussion, depression, concussion in collegiate athletes, depression in collegiate athletes, and then concussion and depression in collegiate athletes as well. So when I was looking for things, I wanted to include studies that used current collegiate athletes, studies that were published in a peer-reviewed journal, studies that were published after 2000, and then studies that reported mainly on mental health along with concussion. Things I did not want to see or include in my studies were international sports, studies that solely talked about retired athletes instead of collegiate athletes, and then anything that did not mention mental health and concussions as well. So when conducting the study, I found around 1,700 results. After using those specific key terms that I mentioned in the last slide, I narrowed it down to about 150, and then I used 3 articles for this presentation. When evaluating my quality assessment, I used the Strobe and the Prisma scale, and they were pretty good with their scale. There's pretty good evidence with this stuff. So in this first study, the purpose was to review long-term effects of a sports-related concussion. 18 out of the 24 studies were related to mental health and then associated with sports-related concussion. In the conclusion for this one, there was evidence that showed that depression symptoms could be a long-term effect with sports-related concussions in both currently competing and also retired athletes. The rate went up more if a student had 3 to 4 concussions previously, their chance of getting depression after those concussions were higher than ones that had like 1 or 2 concussions previously. This second study found that in concussed football athletes, they were able to have like a partial recovery of their symptoms, but not a full recovery of their mood symptoms on day 13 and 44. Athletes reported depression symptoms at a baseline, which is usually done before a season, kind of goes over all of your symptoms, were 4.59 times more likely to experience post-concussion depression symptoms than athletes who did not report any of those symptoms at their baseline. Like I said, in the last one, if you have a history of 3 or more, it kind of goes up. Your depression symptoms go up if you have a less amount of concussions. And then in this last one, the purpose of the study was to describe the prevalence of depression symptoms in collegiate athletes at a baseline and post-concussion. This group had 84 collegiate athletes with a concussion, and then 42 collegiate athletes that had no history of concussion as their control group. They were giving a screening test 2 times during this study. The control group was just given randomly at 2 times, and then the other 84 collegiate athletes were given at their baseline and then post-concussion as well. So about 20% of them had an increase in depression symptoms. The more athletes reported depression post-concussion than at baseline, and then only 5% of that control group showed an increase in depression as well after their concussion. For my clinical bottom line, I found that when gathering research and looking at all of the conclusions and results of the studies that I have used, I found that there is an associated link between depression and then if an athlete has concussion. Implications for me as a future athletic trainer and just anyone in the sports medicine world in general, I think it's important for us to know the risk factors of concussions and then also the symptoms an individual may have if they have depression, and then when to refer them so that we can get them help immediately instead of kind of prolonging that process so that they don't have those long-term depression symptoms in the future. For future research, I believe that they should investigate other patient populations such as like professional sports, and then also coping strategies as well, and how to manage the depression. So, in conclusion, to answer my clinical question, yes, I do believe concussed collegiate athletes are more susceptible to depression, with there being evidence-based research shown that there's association between concussions and depression. I think it's essential that athletic trainers are aware and then are able to advocate for those athletes as well, because mental health is extremely important. These are my references. Thank you to you guys for listening to me, and my classmates, my family. Any questions?
Thank you for that very interesting study. You said that you found about 150 papers on your search, is that right? Something like that?
Yes.
Yeah. Did you put it all together and do any kind of statistical analysis on that whole data set?
I did not. I kind of went through the ones that, well, a lot of them came to be like retired athletes that kind of talked about CTE, which is what I wasn't really looking for. And then a lot of them talked about like military, which I thought was interesting as well, and how they get concussions and they have depression symptoms as well. But I had to narrow it down to collegiate athletes that were mainly talking about collegiate athletes and then depression. So that's how I got down to 3.
Oh, okay.
Yeah.
All right, thanks.
It's still really new information, so I think it just needs to be studied a lot more.
Any other questions?